Hello, and welcome back to Educate Me MD. Today we will continue on the journey of a newborn who's only a few hours old, focusing on the vitamin K shot and hepatitis B vaccine. I'll go into uncommon depth on common topics to explain the ordinary in a new way, so please join us. I am Dr. Sarah Soltz, a general pediatrician in Texas, and welcome to today's episode of Educate Me MD. I'm excited you're here and can't wait to dive into our next topic. In the prior episode, we discussed the newborn exam and the erythromycin eye ointment to prevent newborn pink eye. Today, we're going to discuss the vitamin K and hepatitis B treatments that are usually given around the same time within an hour or two after birth. This episode will be a little longer than my others as there's a lot of detail I want to share. So vitamin K, or phytonadione, is an essential nutrient and routinely given as a shot into the thigh muscle and the leg of newborns. We use the thigh because it's one of the biggest muscles in the body and can handle the medicine the best. It is given in order to prevent something called vitamin K deficiency bleeding, and it's also called hemorrhagic disease of the newborn. But I will use the first term more here. These are both very descriptive terms, but let's break it down a little bit. So vitamin K is one of four fat-soluble vitamins with A, D, E, and K, and it is essential for the normal blood clotting mechanisms to happen in the body. Hence, if you don't have enough vitamin K, then you're at risk of bleeding. Makes sense. So the disease that happens when you don't have enough is called vitamin K deficiency bleeding, or the other term was hemorrhagic, meaning you bled a lot somewhere in the body. Disease of the newborn, because this particular disease is usually isolated to the first few weeks of life, although it can happen as old as 6 months, especially if there are other risk factors. So fat-soluble vitamins are often large molecules that do not cross the placenta or into breast milk, as well as water-soluble vitamins, which is why we also often worry about vitamin D levels in newborns. Also, babies are often low in the bacteria in the gut that make vitamin K, so right at birth is one of the most concerning times for them to have a significant deficiency. Vitamin K deficiency bleeding has almost disappeared as a result of this prophylaxis, which has been done since the 1960s. It's hard to know the exact incidence because it's not a reportable illness, but we'll talk a little more about that later. Although there are some studies showing that maybe it's increasing again because there has been a decrease in the use of vitamin K in some populations. So the symptoms of vitamin K deficiency bleeding include oozing from the umbilicus or the belly button, diffuse bruising, blood in the stools, jaundice, or irritability, but some cases may present with only the most serious symptom, which is intracranial bleeding or bleeds in the head, and that's the main cause of death in these cases. Intracranial bleeding can occur in several different locations in the head and can present with a bulging fontanelle, which is that soft spot, and a change in behavior or seizures. I have not personally cared for a baby with vitamin K deficiency bleeding, but I wanted to give a quick case that I read about from a baby who did have this illness so that you can understand it a little bit better. So in this case, he's a 4-week-old baby who was born at term to a 32-year-old mom, and his parents chose not to give him the vitamin K prophylaxis, so either shot or liquid. He was mom's second child and had been exclusively breastfed up to that point. Mom brought him to the emergency room because of blood in his stool, vomiting, fatigue, and poor feeding that were slowly worsening. On the surface, these are fairly common newborn issues, but this is where things get a little bit worse. On his exam, his heart rate was elevated in the 180s, and he was irritable and was noted to have some abnormal movements. So the doctors ordered a spread of labs and also a CT of his head. The CT showed multiple bleeds, unfortunately, and swelling in the brain. The abnormal movements were diagnosed as seizures, and he was started on several different medicines to help stop the bleeding and the seizures. His labs showed his blood was not clotting normally and that he had vitamin K deficiency. This is obviously super scary, and in this case, he was admitted to the pediatric intensive care unit, and after prolonged treatment, he did survive and was eventually able to go home on 2 different anti-seizure medicines. The article doesn't mention his long-term outcome, but I would suspect he continued to deal with effects of the brain damage throughout his life. This is a published case report, and you can find the link in the show notes if you want to see more details or even the CT images of his brain. Okay, I wanted to give you some numbers to help understand that this is not common, but is very serious. The CDC reports that vitamin K deficiency bleeding can happen as often as 1 in 60 to 1 in 250 births. I feel like they don't show good data to support that incidence, and it's hard to know the true incidence because we give the prophylaxis to a majority of babies, so we don't really know what it would be without that. But even among a population that was given the vitamin K shot to some of its newborns, the rate was about 1 case in 50,000. That was a study done in Great Britain, and they did show that the few babies that got the vitamin K deficiency bleeding over a 2-year time period did get very sick, a lot like the baby in the case we showed, and had a high probability of getting brain bleeds or needing neurosurgery. And out of about 27 cases, I think that they showed there were 2 deaths. So obviously a baby that doesn't get the vitamin K shots at greater risk for this disease than a baby who does, and there are only very few rare reports of a baby getting vitamin K deficiency bleeding after getting the shot. So let's dig into some reasons why someone may be more at risk of getting this disease. So these are risk factors for anyone, whether they were given the vitamin K shot or not. So 1, if mom is taking any medications that could interfere with vitamin K metabolism, such as seizures or anticoagulant medications. 2, if she's exclusively breastfeeding, that can cause her baby to have lower vitamin K levels because, like we said, it's a big molecule, it doesn't cross as well into the breast milk, and formula is fortified with extra vitamin K. 3, if an infant has liver or GI disease or an illness that affects fat absorption, something like a cystic fibrosis, or if the baby has prolonged diarrhea, or if mom or the baby are on antibiotics, because those things can all affect the gut bacteria that make vitamin K. And finally, if a baby is born premature, then they're more likely to have low vitamin K levels because the liver and blood clotting systems are still immature and can't make or use vitamin K well. So they're at risk of bleeding. Some people ask if mom or baby can take oral vitamin K, and this could be an option, although it's not quite as effective as the shot. So if you want the most effective prevention, then the shot is still the best option. The few babies who developed vitamin K deficiency bleeding in one study that I read after receiving oral vitamin K, several of them had an underlying disorder or risk factor, but not all of them. And so it's also important to know that you likely wouldn't know if your baby had one of those liver diseases or underlying problems because they often don't develop till later in life. So the bleeds may be the first sign of a problem. So also remember that the vitamin K molecule is big. So if you're taking it as an oral dose, less is going to get into the body and be processed and stored as compared to the shot. So a typical dose of the vitamin K shot is 0.5 to 1 milligram of K1. And with the oral regimens, there's various regimens ranging anywhere from single dose to 3 doses to weekly for 6 months. And there's no standardization because it's not an accepted method of getting it. Another issue with the oral treatment is that the liquid vitamin K drops can be unreliable. So there are no brands approved by the FDA, so any that are out there fall into the same issues as with most vitamins and supplements, that they're often not third-party tested and may not have the reported amount of vitamin K in them. So to summarize what we've said so far, the risk of getting vitamin K deficiency bleeding is low, but not zero. And if your baby does get it, maybe because they have an underlying disorder that you don't know about yet, then it can be a very severe disease that causes significant brain damage or death. Overall, the risk of side effects from the vitamin K shot are limited to possible pain, swelling, redness at the injection site, and extremely rare occurrences of allergic reaction. If an oral vitamin K regimen is considered, it should be continued for several weeks or months after birth to allow time for gut maturity and not just given as a single dose. Therefore, although it's rare, vitamin K deficiency bleeding can cause severe disease, so I feel this treatment's important to continue and is likely to save several lives every year with minimal risk. Okay, shifting gears. The next thing I want to talk about now is the hepatitis B vaccine. So I want to start with some background information, then review the hepatitis B illness, and finally discuss details of the vaccine and then any special risk factors for the illness and the vaccine. So in 1991, it became standard of care to give all newborns the first dose of the hepatitis B vaccine within 24 hours of birth to prevent transfer of the infection from an infected mom. At the time, the AIDS epidemic was in crisis mode, and although the scientists had not been able to find a vaccine for HIV, they did for hepatitis B, which was often an associated illness because it spread by similar methods. So the concern was that the virus was often silent, and so a mom may have it and not know it, and then would pass it on to her baby. Our testing was also not as accurate at that time, and so, again, a reason why we may not have known that she had it. Since the Hep B vaccine's a recombinant vaccine, that's a special immunology term, which basically means they use a protein from the virus's surface to trigger our immune system to make appropriate antibodies. So you can't get hepatitis B from the vaccine. It also means that you need more than one dose to create immunity. So after the initial dose, the series is continued with 2 to 3 more doses given between 1 and 6 months. It's given as an intramuscular injection, usually into the opposite thigh from the vitamin K to prevent one muscle from having to take both shots, and also helps us to know if there was a reaction on one side or the other. So hopefully that gets well documented each time it's given. Also, just an interesting side note, I think, is that the hepata prefix is a medical word for liver. So hepatitis is inflammation of the liver, and a hepatologist, someone who treats those with liver disease, and so on. So hepatitis B got its name because it's one of several viruses that mostly infects the liver. The infection can either be acute and resolves with supportive care in a week or two, or it can become a chronic infection that could persist for years and eventually lead to liver cancer, cirrhosis, liver failure, those sorts of diseases, which could be very tough. There is not a cure if someone develops chronic hepatitis B, although we do have some medicines that can treat it relatively well. And we do now have good tests to determine if someone is infected with hepatitis B, and all moms who receive routine prenatal care are tested for it. So basic biology, going back to mom and baby, tells us that if mom is negative for hepatitis B and an infant is not exposed to the virus through exposure with an infected individual's blood, then there's no way that the baby can get the virus. There's often an argument given to support giving this vaccine at birth that a newborn could be exposed to hepatitis B through a contaminated blood transfusion. I feel like this is a weak argument because not only is the likelihood of a healthy newborn to need a blood transfusion fairly unlikely, though obviously this isn't true for preterm babies or those who need surgery, but all blood is also tested for viruses like hepatitis B and HIV, and the likelihood that a blood product would be contaminated is literally over 1 in a million, and even over 1 in 2 million for HIV. So there's also research looking into how long the effects of an infant hepatitis B vaccine will last. Like I said earlier, it's usually a 3-dose series, and initially it was thought the protection would be lifelong, but newer studies are showing that it may decrease after 10 to 30 years. I have a personal story about this because I received the hepatitis B series as a child, and I had immunity when I was tested in my 20s when I went into the military, but lost my immunity when I was retested for a new job in my 30s. So I received another 3-dose series of hepatitis B vaccine at that point. I knew that because I'm a medical professional, I have an increased risk of needle stick or exposure to infected blood, so I wanted to keep my titers in a healthy range. When you look at the CDC data of new hepatitis B cases, it's interesting because they're mostly occurring in people older than 50 years old, which also points to waning immunity or maybe those who never got the vaccine to begin with. I mention this because it may be worthwhile to give this vaccine a little later in life so the immunity can last further into adulthood when the risk of exposure may be higher. Overall, I think it's important, as I have said before and will say again, that with any medical treatment, you have to look at each individual and decide their risk level and give the vaccine at the best time for them. The most common side effects of the hepatitis B vaccine are redness, swelling, pain, or a lump at the site where the shot was given in the leg. Also common are headache, fatigue, low-grade fever, nausea, and vomiting. Less common reactions are rash, joint pain, swelling of the face, diarrhea, and the most severe reactions, which obviously do not happen very often, but can be autoimmune reaction or even death, which would usually be from an allergic reaction that didn't get treated quick enough. So, risk factors for an adverse reaction could be having a close family member who had a significant reaction to the vaccine or a significant reaction to a prior dose if it's an older child. Also, the current guidelines are that if a newborn weighs less than 2,000 grams, which is 4.5 pounds, and mom is hepatitis B negative, then they should not be given the vaccine until they're bigger. But if they are less than 2,000 grams and mom is hepatitis B positive, they could still get the vaccine and get another medicine called HBIG, which is hepatitis B immune globulin, which is one of the treatments for hepatitis B, in order to treat any virus that may be present in the baby after birth. And that dose, when they're that little, wouldn't count towards their full series. So there's always lots of these little details with the different vaccines that's important to know. So if mom has no prenatal care and or has high-risk activities during pregnancy, such as multiple partners or IV drug use, possible exposures to others with hepatitis B, then the newborn should definitely be given the hepatitis B vaccine, no question. Otherwise, I think it is reasonable to wait until the child's a little bit older so their body can create better immunity that will last longer into adulthood. This is not an infection that I would like to have, and I do think that the vaccine is usually well tolerated and most side effects resolve fully in a short period of time. It creates a good immunity if all doses are given, and so we should continue with universal protection, which means for everybody of all ages should be immunized as opposed to just a select or high-risk group. I expect to do another episode at some point on vaccines, and we'll go more into depth on exact efficacy of the vaccine, additional ingredients, as well as some different versions of the vaccine. So, this concludes my discussion on hepatitis B and vitamin K. I hope this has been informative and helpful. If you listened to my prior episodes, you may have noticed that I did not mention our little baby girl that we were following, and that is because this was a more technical discussion. But she will be back, and the rest of the day, the first day of life is usually spent sleeping, feeding, snuggling, and repeat, and hopefully without incident. In this case, we'll assume that she received both of these treatments and tolerated them well. Next week, we will continue on through things needed before discharge, if birth was in a hospital or just in the first week of life. There are a lot of changes that await. So thank you for listening to Educate Me MD, and I hope you have a wonderful day. Quick disclaimer, the information in this podcast is strictly educational and entertainment and should not be taken as professional medical advice. Even though I am a doctor, I am not your doctor, and you should always consult with your own healthcare team before making significant changes to your care. Thank you, and have a great day.